Anxiety medications come with side effects that many people just don't want to deal with, but with the right guidance, these medications can be safe and effective in treating anxiety. Joining us today to discuss the pros and cons of anxiety medication is Bernadette Ackerman, a psychiatric mental health nurse practitioner at McNulty Counseling. Welcome back to Bloom, Bernadette.
Thank you, Gail. It's great to be here.
So this is a subject that, people sit on the fence about. They know about the side effects and they know about the benefits, but unless you have that right connection with your doctor or nurse practitioner, it can be kind of scary to know how to move forward.
Well, I think the biggest thing is first identifying, what type of anxiety you have and whether or not it would benefit from either counseling or medication. And that's where it's really good to get some professional help. Many people start off with just therapy, and then a therapist can help guide them to know whether or not it is the kind of anxiety that could respond to just medication. But many times people have anxiety that's just kind of wired in their brain. And those types of anxiety, really maybe sometimes panic disorder or obsessive compulsive disorder, those kinds of disorders may really just respond to different types of medication. And so it's really helpful to get an evaluation from somebody like me or a psychiatrist to help you evaluate whether or not medication may be helpful.
So what are some of the downsides or that people might be scared of getting on these medications?
Well, I would think the biggest one, of course, is always the stigma of being on some type of mental health medication. But mostly the first type of medicine that we use for anxiety are the serotonin-based medicines, which are most likely known by Zoloft or Prozac. Those are called SSRIs. They're selective serotonin reuptake inhibitors, and they're fairly safe for the most part. I mean, we have children sometimes that have anxiety disorders that will start with these medicines, and they're fairly safe. The most common side effects are mostly GI symptoms. If you take them with food, they're tolerated fairly well. As we get older, sometimes they can have sexual side effects. But like with most of the medications in all of these groups, as long as you're educated on them well and you take them correctly, we can work with the side effects and then know what to do once that happens. The second group of medications that we would use in this group are either SNRIs, which are medications that work with serotonin and norepinephrine. Then we would go to another class, which is called Buspar, which is a medicine all by itself that is just for anxiety. And then the other class is benzodiazepines, which people are very reluctant to start because they have this huge addictive potential. So that would be a medicine like Valium or Klonopin, Ativan, or the famous Xanax.
Yeah. What about weight gain? And that's always an issue for folks, or sometimes can be.
Yes. The serotonin, the SSRI medications, there are ones in that class that have been known to cause weight gain. Some of them are more common to cause weight gain, but there are ones in that classification that do not cause as much weight gain. And as with all of these medicines, they're individually based, and you can talk to your provider which are more known to cause weight gain or not.
And you sit down with patients because you mentioned like some folks are just pre-wired and they might need to be on these medications for an extended period of time or maybe even for a lifetime. But then there are others that might just be dealing with certain situations where it helps guide them through this without being overly anxious, and then they can wean over time. Talk to me about that.
Yeah, I mean, depending on what your diagnosis is, we have people that are going through a crisis situation, maybe a divorce, maybe a custody battle, maybe something at work, that would receive a diagnosis that we would maybe call an adjustment disorder, where they're going through a depression or an anxiety issue. And they might go on this medicine for a short term, maybe 3 to 6 months, to get them through this crisis, and then they could taper off and they could come off without an issue. Other people may have a genetic predisposition to anxiety or depression. They may be people that have to stay on it for a long time. If you've had a lot of trauma in your childhood, that would lead you to maybe needing medicine for a long time, because your brain is actually wired for chaos. It's used to an environment where you don't know what's coming around the bend. And really, those kind of people sometimes would really benefit from these kinds of medicine, because they don't know what to do in environments when everything is going well.
Yeah.
And so
that's very interesting.
very often.
More often than not, I'm sure. That is so fascinating. Well, I think the biggest takeaway from this is to make sure that you get with a provider like Bernadette, really understand so that they can guide you into making the correct choices. Thank you so much for joining us on Bloom today. It's always so great to see you.
Oh, it's always great being here. Thank you so much.
And for more information, you can visit McNultyCounseling.com, and we'll be back with more Bloom right after this.